I'm not just here today to share my idea with you. I'm here today to start a movement. The last year and a half has not been kind in my family. I've lost my brother and my aunt. These have not had the best health outcomes for my aging parents. And it's not doing wonders for me either. It's made my workload higher, and I've lost people to help me carry the workload. I want to keep my family well for as long as possible before they get sick in the first place. How do we empower normal people like me to lighten the load on the healthcare system and at the same time maximize the quality of life with our aging parents? Self-managed care is becoming increasingly important. That's why I developed IMOK, or IMOK. It's a family-powered concierge service centered around the needs of our aging loved ones. It's like Starbucks' third place between home and office, except for that place between mom and dad's and the hospital. Except it's available from the push of a button and it's with you all the time on your phone. We felt it was important that a family and community-based approach be taken for personalized task management and support of our aging loved ones, members of our society. Let me show you how it works. Here we have my dad and his brief snapshot of the key activities that we need to stay on top of as a support network for this week. I knew I'd be here with you today, bitching, and I wanted to make sure that I got help to make sure my dad was taken to his doctor's appointment this afternoon. So I came into the app and I added in my medical appointment. From here, I can capture keynotes I wanted to make sure were covered in a discussion with the physician, and at the same time have some capability to follow up in a routine way and make sure that we had coverage to know who it was and notify anybody that needed to be notified. The nice thing is through an invitation link I send my brother, he has the same view on his phone as well, regardless of what technology he's using. So I asked him to go into the task area, and he was able to quickly get a snapshot of the key things that had to happen today and this week to cover off all his needs. With a quick push of a button, he was able to sync all this information to his phone and work in the fashion that he's most familiar and comfortable. Increasingly, we're getting older, we're living longer, into our 70s and 80s, and it's becoming more common. A tool and an approach like this is important to empower a community of care and support, whether it be the family or whether it be others in this community, to improve his quality of life, maximize the precious time we have left together. I'm okay. Are you?
So I really like how this speaks to the sandwich generation and the idea of really better engaging not just the patient and the care, but also the family, and in a way that tackle some serious barriers. How do you see the health system being able to help you with this?
I think experts could help us shape a lot of the particulars. You see as a rough sketch idea. I think getting the right kind of promotion and reach out to the community, I think would be a key way to help with that. I think another way that they would really be able to help is by finding ways for our tools to talk together so that we're on the same page. People like families like me who want to drive better health outcomes for ourselves before we get sick, and at the same time work in a manner that's consistent with the coordinated care available to our health.
How much would you be willing to pay for an app like that?
The question is when. I think in the early days, we're probably looking at a premium solution with a limited amount of, with a certain range of integration. Not too much, not too heavy. It's got to be lightweight in order for this to be viable and sustainable. But I think ultimately in the end, we want to be able to get to enough adoption to it so that we can support a simple model like this for less than $10 a month.